I'll just ask you a little bit about, this topic that you presented, and you can just share some of your thoughts on it with me.
Okay. So to begin, neurodivergence is sort of a new term that communities like the autistic community, people who have other disabilities like even dyslexia or like neurodevelopmental disabilities are starting to use rather than saying a disability. Mm-hmm. And it is pretty much basically that our neurological wiring is slightly different. So different not being negative, but adding diversity to a very diverse human society.
Mm-hmm. So it's kind of a way of humanizing it a little bit. Like instead of putting it into a box of pathology, it's more about seeing people for their uniqueness and who they are.
Yeah. And I think that it's important because, we started by putting things on a spectrum. And spectrum was kind of a good start because it was no longer just a box that you were put into. You could have a diagnosis and still that didn't define you. But the problem with the spectrum is that you get high functioning versus low functioning, and it makes it sound, if someone is high functioning, it can sound better than being low functioning. But at the same time, if you look at it as diversity, then these people are put at an equal level. Mm-hmm. And so it brings kind of everyone together and looks at it like, yes, we have this thing in common, rather than like putting them on different levels of functioning.
Yeah. And how do you see this being received from people, like shifting from getting these diagnoses to having this more kind of humanistic or broad understanding? How do you see people kind of taking this and receiving it?
It's interesting because I work with kids, and so even the other day I had a child come into where I work, and he has autism, and he came in with an assistant who had a very strong behavioral approach. And not that everything about a behavioral approach is incorrect, but she was new to working with this child, and she was sort of just defining him by his diagnosis and what she thought his behaviors would be. And so it's still very much alive to kind of use these sort of old school ways of looking at diagnoses like autism. But at the same time, there's communities like the autistic community that's kind of stepping in and saying that didn't help them. That when, especially adults, autistic adults are now speaking up and saying, as children, these approaches didn't help us. In fact, some behavioral approaches can be very isolating, and this is where I really think it connects to complex trauma.
Yeah. Yeah, we talked a lot about that in the class that we were in together, and from our perspective, working with complex trauma, with early trauma, the child is profoundly missed by their caregivers, by their environment. And so I really appreciate what you're saying, because you can see how even with the best of intentions to try to name what's going on for the child, we can lose focus on what's actually going on in the inner world and focus too much on the behavioral.
Exactly. When you reduce a child to ABC charts and like an IEP and you're just looking at this child as the paperwork that represents their behavior or what they're good at, from a neurotypical perspective, then you're reducing that child and then isolate them. You're not supporting what's going on inside the child. Yeah. And so an example is, I was working with a child at a middle school, and he was an 8th grader, and he was in the lowest classes possible. So he was put into like intro to English, intro to math, because he struggled to sit in a chair, he struggled to focus, and he was very impulsive. However, if you brought him to an environment where he was more comfortable, like out at lunch, he would sit and talk to me about his theories on the physics of black holes. So like putting him in an intro math course where he's still doing addition when he's very capable of these more complex concepts is limiting that child.
Yeah, really missing the child.
And stigmatizing. It stigmatizes them.
True. Yeah, so important that he has someone like you that he can, share about his passion with at lunch.
Yeah.
One of the things that I was blown away by when you presented in the class was about, because, my interest is in working with early trauma and complex trauma. And you put this together, you linked complex trauma with this neurodivergent model. And I wonder if you could just speak a little bit. I'm sure most people probably don't know much about it or about the link. So could you share a little bit more about what you were putting together?
Yes. So I've been doing sort of some personal research on it. And again, a lot of this is coming out of the community of autistic adults. So there's a organization, the Autistic Women's Network, and Autistic Non-Binary Network. And one of the articles they recently published was, it was connecting autism with comorbid conditions, and how the majority of women were being diagnosed with depression, anxiety, and trauma, and before they were receiving autism diagnoses. And so that's like a big red flag right there, that something's being missed. And when you look at it, there's so many overlaps with the behavior, the sensory overstimulation, the activation of the nervous system, impulse control. So all of these things really overlap. And if you can treat both, if you can look at it like a whole instead of trying to treat just the trauma or just the autism, then you can really start to actually help this person a lot better.
How is that being received, kind of in the more traditional community?
It's interesting because some people are really eager, to try new things. Because really, if you're, for example, working with an autistic child and they're struggling, you really want to try anything that'll help them. But it can also cause issues. So one of the articles I was reading was about a woman, and she was in the UK. She had taken her son to the doctor. He has every symptom of autism, but he was doing okay in school. And the doctor told her that he couldn't diagnose him because he was succeeding. And so he said, give it a couple years when school starts to get a little more difficult and social pressures get harder. Once he starts struggling because of his autism, then we can give him the official diagnosis.
Wow.
And so she interpreted that as once this individual becomes traumatized, when society is no longer accepting them and allowing them to thrive, that's when you can get the diagnosis.
Yeah. Yeah, I know I said this in the class, but when I used to work with children, I always would talk to the teachers and to the school that it's not the bullies, it's not the kids that are having the bad ADHD and acting out in class that we have to watch for. It's the kids that are being missed in the back.
Mm-hmm.
And a lot of the kids that fall on the spectrum, they are kids that aren't actually acting out and making it hard for a teacher with 30 students. And they can slide through the cracks and be really profoundly missed.
Yes.
Yeah.
Exactly.
So then my last question for you is, you know, I like to title these videos as moments of connection. So my question is about, you work with children, neurodivergent children, and you're in a community of adults. How do we reach people? How do we connect to them in a way that can be supportive, that can be providing opportunities for the growth or healing that they're really looking for?
I think that a huge part of it is starting internally. So starting inside, researching it ourselves, talking to people who have these conditions, and just listening. Because a huge problem, if you go back 10, 20 years, is that a majority of the people that were speaking for autistic people were non-autistic people. Yeah. And so now you have platforms where autistic people can speak, and even nonverbal autistic people have ways, thanks to modern technology, of communicating, and they're trying to tell and share their experience. And so it's encouraging, for example, parents of autistic children who are feeling lost to seek help not only from other parents of autistic children, but also from autistic adults.
Yeah.
who can help, who can sympathize and understand those experiences.
Oh, I could see how that could be so powerful for a parent that's really struggling. I mean, it's really nice for them to have support from other parents, but to actually meet adults that have been children who were feeling maybe disconnected from their parents, and giving that advice to the other parents about what it is that they can do to help create greater connection with their child.
Yeah. And on top of that, I would say, this is like the question I could really go on forever with. I have like a whole list. But just looking at every child with, or adult with, any, neurodivergent condition as like immeasurable potential, rather than a broken person. We so often look at it as a disability, and it is. The reason a lot of autistic people prefer to be called autistic people rather than people with autism is because it affects their life so much. But at the same time, it also doesn't stop them from being a thinking, feeling, amazing person.
Yeah, well, that fits really well with, our model of working with complex trauma, that we see how the pieces of the self, the parts of the self that have been damaged or ruptured in different ways, how that in the process of putting them back together and getting the right kind of support, it can be what we call post-traumatic growth, that people have potential that they haven't even imagined for themselves as they're able to start putting some of these pieces together.
Yeah.
Well, thank you so much for this, and thanks for all the work you're doing to bring this to people's attention and to support families and children. And anything else you want to say to wrap up here?
I mean, I could go on forever, but I just want to say that for anyone who does watch this, to like go check out some of these like autistic voices and just start there, because it opens so many doors. It's really amazing.
Yeah, and you shared a couple of videos from YouTube of people talking about their own experience, and that was very touching and powerful. So I encourage people to go just kind of dance around YouTube for a while, and you'll find some really good stuff.
Yeah, exactly.
Well, thanks again, Michelle.
Yeah, thank you.